Show. Keeping your money safe and secure. Giving you predictability. Have the retirement you deserve with our Save Money strategy. All the financial news you need. We're here to help you succeed on your Save Money Show.
Welcome to your Safe Money Show, your go-to show for navigating through financial retirement issues. I'm your host, Todd Schoberg, and today we're diving into a topic that affects millions of Americans, Medicare. Whether you're approaching 65, helping a loved one, or just curious, we're going to break down the basics of Medicare in a way that's clear and straightforward today. And joining me, my co-host, is Mr. Tony Shore, who will help me stay on track and add his many years of wisdom to the show. Good morning, Tony.
Well, let's not get carried away with the wisdom talk. That's your area.
Well,
You're the
you got
expert.
wisdom that we don't even know about, but we're going to find out what it is.
Yeah, I mean, if we're talking pizza or music, I've got a lot of wisdom in those areas, record collecting. But you're right. I really appreciate you having me on the show, and it's great to be here. We all know that you're the brains of the operation and I'm the eye candy. I've said that before. I've said, listeners, I try to tell Todd, you've got the perfect face for radio. I've said that many times.
Amen.
And no, I'm kidding. So, Todd, how have you been, though? You've been keeping busy. You've got a lot of appointments. You've been meeting with so many people. And it's mainly about, especially coming up here, October 1st, Medicare season, right? Yeah. Now is when you can start planning and open enrollment begins, right?
Medicare is going to be the thing, and that's why we want to talk about it today. But I just thought we'd just chit-chat a little bit about the weekend because, man, did I have a busy weekend. Friday night I went up to see my gentleman that I hunt with then up there north of Mora there. Yeah. And we've been getting together since we were in ninth grade.
Oh, wow.
So we're the same six guys that have been. We went up and looked at trails and make sure the shack's in good shape and maybe played a few hands of cards. Yeah. And we got to know each other and got caught up on our lives. And that's always a fun thing to do. We've been doing it a long time and still they're all best friends. So that's rare in itself. Most people say if you have one best friend after leaving high school, you're in good shape. But these are all my favorite buddies, and it's been always a good time.
That's awesome.
And then Saturday night, I worked on a benefit, and they had me cook my wild tasting fish for 130 to 150 people for their banquet, and they had a great turnout, and I got lots of compliments on my fish recipe. They were so impressed, they asked me back next year.
Well, I'm sure. You cooked for how many people?
Well, there's 130 to 150 people there, so
you made a lot of fish. I mean, I hope you don't get a big head from that Messiah complex. It's like the loaves and fishes that Jesus multiplied the fishes. You fed the masses with fish.
I started with one, and the end of the night, I still had one to cook. Yeah, I don't know. It's done. But Jesus said, go fishing, and I go fishing.
Yeah.
But yeah, we had a good supply of local fishermen that donated their fish, and we cooked
that's
it up.
nice.
And, we had all wild game feed. Wild game feed. So we had salmon and deer and antelope and pheasant, and we had the whole works. So
I've been to a wild game feed. They used to have a big one every year, and my parents took me, and they made one year. I'll never forgive them, and I never went back because they lied to me about what it was. Oh, this is chicken. Or, this is something. They described things I was used to eating, and I didn't realize I was eating Bambi and Fluffy the rabbit, and they had rabbit and deer, of course, which are typical. But then they had something called Rocky Mountain oysters, and that was wrong.
Let's not talk about it too loud. It's early in the morning.
Yeah, no, we're not going to get into that or what that is. Folks, you can figure that out on your own. But trust me, you don't want to know.
No, but I've had them and I've loved them.
Well, yeah, whatever. Like I said, let's not get into that, Todd. That's not. I had it and I didn't like it, but I think 7 or 8 when they first forced that on me, and I'm like, this is not. I didn't like. Of course, I don't really like oysters. I didn't like the texture is the main thing I didn't like, but the flavor, I guess, is there for a lot of people. A lot of people love wild game, and that's why they have these big feeds. I didn't know they still did wild game feeds anywhere.
No, we used to do them years ago, but we had a gentleman in our church that decided it's time to bring it back.
Oh, wow.
And I always try to taste a little bit of everything, and I found a dish that I just fell in love with. And Martha Gottfredson, I know I've known her for years, had the recipe for pheasant, and it was delicious.
I've had good pheasant as well. We had a neighbor that cooked pheasant, and of course we had a lot down in southwestern Minnesota where I grew up in Worthington area. That's pheasant country down there in the prairie. Yeah, absolutely. So there's a lot of pheasants down there.
Yeah, so we had a great time. They raised good money, and I know they're going to do it again. So we're going to be offering. I'm going to bring that up next year on the show to make sure we get as many people there as possible, because they had prizes and raffles, and it was just unbelievable for a first
and
year.
It's to raise. Was it to raise money for a charity?
No, it was for the youth of the congregation that we were working with.
Oh, for a church, yeah.
No, so that was good. I actually wore a shirt that says "Go Fishing." John 5:6, I believe.
Oh, yeah.
And then underneath there, it says, Jesus didn't say, fix the sink, clean the garage, sweep the floor. He said, go fishing.
So that's what they call script texting, where you take scripture out of context to meet your personal needs and to reinforce what you want to do, Todd.
Yeah,
all right. Todd, script texting. All right. Well, hey, let's start with the big news, big Medicare news. This is what people have been waiting to hear about, and what I've been waiting to hear about, because I have 2 parents now, both in full long-term care. They need the full care. My mom's is $11,000 a month. I think my dad's is up near 10, and they both are on UCare for Advantage. That's the cost to live for the facility. That's not the cost of their insurance, but UCare. Give us an update.
Yeah, I'm going to give you an update, and I'm going to read it from a news release because I don't want to miss anything. UCare, a major nonprofit health insurer based in Minnesota, has announced a significant shift in its Medicare offering for 2006. The company is exiting the Medicare Advantage market entirely. Effective January 1st, 2026, the decision impacts approximately 158,000 enrollees in Minnesota and parts of Wisconsin, who currently represent about 26% of the state's MA market.
Wow.
UCare's requested mutual termination with MA medical advantage contracts with the Centers of Medicare and Medicaid services. And I have a pending approval, but it's been approved. And the reason is financial pressures. UCare cited raising medical costs, stagnant reimbursement rates from CMS, which is Center of Medicare Services, and broader industry challenges as a primary driver. They lost $504 million in 2004, a sharp increase from prior years.
Yeah.
And they just feel they can't do it, but
that's too bad, because they were in my opinion, because my parents had them for a while. My mom's been in long-term care 3 years. She's had UCare. She started with another company. I won't name names, but she had UCare, and her facility was much better on UCare with it, and it worked much more smoothly, and their offerings were great. She loved it. My dad did well on it. And when you told me that this was happening, I would not know about this if it weren't for you either. I think UCare sent something out, and I missed it, but wow, this is big news.
Yeah, actually, all members will be receiving a letter that'll be mailed out on the 1st. So you should have it in your possession by now.
Yeah.
So Saturday, you should have it now. Yeah. So if you open that and are panicking, this is what you have to do. Number 1 is the annual enrollment period for Medicare is October 15th through December 7th of 2005. You need to switch to another MA plan from one of the competitors like Blue Cross, Medica. There's a bunch of them. You should be working with an agent that, carries several for you. enrolling in Medicare, you can roll back just to Medicare itself with a Medigap policy, supplement policy. Those are either high deductible or you can have a full coverage plan. There's a wide variety of Medicare supplements out there. And then the big thing you need to know about is that with the MA plan, you get your Part D with it. And if you're canceling that, going back to just Medicare itself, I don't recommend that, but some people do that. You can get a standalone prescription drug plan if needed. That's what it is. Now, here's the other thing. UCare and myself recommend reviewing your current benefits, doctors, hospitals, and prescription drugs now. So you have that at hand when you start shopping for your plan. And remember, this only affects Medicare plans, not individual UCare health plans. It's just their Medicare.
It's just their Advantage plans, the UCare, Medicare Advantage, and Medicare supplemental plans, not regular health insurance through UCare.
Yeah, so if you have bought it on the MNsure site or MNsure plan or individual plans, that is not affected. It's just Medicare Advantage.
Yeah, just their Medicare Advantage, which was a really good Advantage plans, our Advantage plan. Now, that said, our listeners out there and people in the community, you offer these things and you look at a lot of different options and where they can go. So they won't be able to have UCare, but starting the 1st, which is now, you can actually meet with people starting now and talk about these things, because the 1st is when it all become made available, and they can start planning. And then the open enrollment, like you said, or the annual enrollment period starts October 15th. But you should start immediately figuring out, with my current doctors, with my current situation, hey, what's going to work best for me.
Yeah, you need to think about it now, and you got time. It's an extended period of time, but like my clients right now, I'm calling them and booking the appointments now. I'm leaving a couple days open a week, but we're going to be filling up fast. And if you need some help, you just give us a call. We'll fit you in somewhere. I think we're into December already, but we'll squeeze you in. And I told the girls here, if I got to work Saturday and Sunday this year, we'll do it. We're going to make people get the coverage they need. We're going to look at their prescriptions. So it's not going to be a big shock. It might be a signature from you and where we're going to get that payment from for the premium, and you make a decision. So we can pretty much do a cross comparison. So there's not going to be a lot of shakeup in your life. The only thing I could say, UCare was glorious with their benefits. They had dental, they had eyeglasses with really nice benefits, and you got actually a debit card, so there was no in-network. You just went and did it. Their co-pays, I never had a hassle with their service department. Right. My clients all loved it.
Yeah.
So they didn't do anything wrong, except they didn't put enough dollar in the bucket to keep going doing what they're doing. And their projections just weren't right. And that happens in business. So when that happens, we have to make some changes, and that's how we have to make them. We have to meet with you, or you can do it yourself. But if you want the help to keep it clean and simple, give us a call. With that said, I thought today also would be a great day to go through the basics of understanding Medicare. There's always so much confusion, but I'm going to try to keep it really simple. So let's kick off this thing with the basics. And what exactly is Medicare? Well, Medicare is a federal health insurance program primarily for people age 65 and older, but it also covers younger folks with certain disabilities or specific conditions like end-stage renal disease. And it's been around since 1965, helping millions access healthcare affordably. And that's what it's been designed for.
Well, and that's great. And so it's not just for seniors, though, right?
No, exactly. You're under 65. If you're under 65, you have to qualify disability. And that's like receiving Social Security disability. And after 24 months, you're automatically qualified for Medicare. Or specific conditions There are a bunch of conditions that you can get it. You can enroll for it, and it's broader. It's a broader spectrum than you think.
Yeah. Well, and I got it. Now, Medicare isn't a one size fits all, right? I mean, it's like alphabet soup.
That's pretty close,
we got, I mean, it's like Sesame Street, like A, B, C, and D. Maybe you could break those down. Today's show is sponsored by the letter D for drug plan. I don't know.
That's a good way to go. And it gets complicated, but let me just go through them basically. Part A covers hospital stays, skilled nursing facilities, hospice, and some home health care. Very little, but some home health care. Most people get this premium free if they've worked for enough years to qualify through Social Security. That's Part A. Part B is the medical insurance. Think of doctor visits, outpatient care, and preventative services like screenings. Now, you pay a monthly premium for this, around $185 in 2025, though it varies by income. And in 2026, your base rate is going to be projected at $206.50 a month. That one, that's kind of interesting. There's a rule out there. If you don't get a raise in your Social Security, they can't increase your Part B. But they've already projected they're going to raise your Part B. So I know you're going to get a raise in your Social Security. I'm just hoping it will cover that increase. And then we have Part C, or Medicare Advantage. This is an alternative to Parts A and B. Now make sure you understand it. This is an alternative to Parts A and B. Private companies offer these plans, often bundling with extra benefits like vision and dental, but you might have different costs with different companies or different networks. And Part D covers prescription drugs. Like Part C, it is also offered by private insurance companies, and the cost depends on the plan you choose. Now, I see plans with Part D from $0 to $215 a month. That's just for Part D. So this is important for you to understand what that is. And I'm going to get into the deductibles and stuff in a minute. So
sure.
It's kind of confusing.
It's a lot to take in. And so Part A and B are original Medicare, and Part C then is like a private plan. Part C is basically the Advantage plans we're talking about, right?
Exactly. Original Medicare is Part A and B, managed by the government. Part C is a private option that must cover at least what original Medicare does, but it might have different rules or perks. I mean, every one of them are a little bit different. We were all in favor of UCare because it had all the perks and all the bells and whistles, and it was priced right.
So when can people sign up?
Well, the key time is your initial enrollment period. This is when you're turning 65. You can start enrollment 3 months before your 65th birthday and ends 3 months after. So it's the 3 months before, the month you turn, and 3 months after. That's a total of 7 months. But if you miss that, you might be facing penalties or delays, especially for Part B. Remember, even though you can enroll 3 months before turning 65, your coverage will start the first of the month you turn 65. And then there's also an open enrollment, which we talked about. It's every year, October 15th through December 7th. And this is for changing plans, like I'd mentioned.
Yeah. And really everyone, whether you're with UCare or another company, even if your company, you're happy with them, and even if they're going to be there, you should always review where you're at and what new things are available, because there are a lot of changes. So plan ahead is what you're saying, Todd. And for our listeners, I want them to know, Todd, you're just scratching the surface here. However, you don't have to do this alone. Reach out to a licensed Medicare agent who offers multiple plans and companies, somebody who's an independent licensed Medicare agent. And Todd, you just happen to be one of those agents. So listeners, you can go to Todd, find out more information, go to yoursafemoneyshow.com to get more information. Again, that's yoursafemoneyshow altogether. .com and get a copy of, Todd, you have a booklet, Medicare 101, and you can go to that website to get it, or they can just give you a call at 855-22-MONEY. That's 855-226-6639. Again, 855-226-6639. So, Todd, let's talk about money next. What do people, and first I actually have a question. If you go with an Advantage plan or a supplement plan, do you still pay the Medicare premium regardless, right? That monthly Medicare premium, or no?
Yes, you always, no matter what plan
That Part B premium, even if you go with Part C and Advantage plan, you whatever that costs, that's on top of your Medicare payment, which typically comes right out of your Social Security check.
Yeah, the only way you're going to reduce or get rid of that is if you're very low income, they're going to give you a reduced rate.
Oh, sure. Yeah.
But I can talk about that to you at any time, but that's the only way that's going to go away or be reduced.
So let's talk about what people do pay for that and Medicare, and where are the gaps we should know about? Well,
Medicare isn't free. We talked about there.
Yep.
But the cost depends on the part. Okay, Mark, and I'll just explain Part A, because the premiums for Part A are usually free if your spouses paid taxes for 10 years or around 10 years. And Part B is what we're worried about, because that's the big premium. That's $185 or so in 2025. And you need to know both A and B have deductibles in coinsurance. For example, Part B today has a $250 deductible. And then you usually pay about 20% of approved services after that. Now, don't get me wrong. This is if you only have Part A and B.
Right.
Okay? That's what your responsibility is with that alone.
Yep. And so there's still out-of-pocket costs with original Medicare, you're saying. There's still copays and deductibles, right?
Yeah, that's where the gaps come in. Original Medicare doesn't cover everything. There are deductibles, and Medicare normally covers about 80%, leaving you responsible for the balance. Plus, this is the thing. There are no caps on out-of-pocket costs for your A and B, which can add up if you're hospitalized or need frequent care, and no coverage for dental or vision or hearing, and very, very limited coverage for long-term care. Now,
there really isn't Medicare coverage for long-term care. That's rehabilitative care, and you have to have been in the hospital and meet certain criteria. So, I don't want our listeners to think that Medicare covers long-term care like you think of a nursing home. It's more if you have knee surgery and you have to go into this assisted living or full-time care facility, but temporarily while you rehabilitate, and then you're going to leave again, right?
I've had people come right out of the hospital, go into a long-term care facility, get and have planned rehabilitation, right? And that's day one. If you're getting rehabilitated, you have coverage for the first 20 days. Okay. Yeah. But I've had people go in that same day and go in as a Medicare patient.
Yeah.
And by the end of the day, their health has gone down. They're getting no more rehabilitation, and they go off the plan. There's no guarantee on that 20 days.
Right.
That's what I want to say. And then after 20 days, if you're rehabilitating, it's a $412 deductible per day. And then after that, it's all out of pocket, and it gets expensive, and that's where your assets start depleting, and it's not a good thing. But don't plan on Medicare covering your long-term care. It's for rehabilitation. That's
bottom line. Yep.
Yeah.
So there's still out-of-pocket costs, deductibles, things like that. That's risky. So is there a way to cover these gaps we're talking about?
Definitely. One option is the Medigap insurance policy sold by private insurance companies. Medigap plans help cover things like coinsurance, deductibles, or even some emergency care abroad. Just a side note, I don't recommend that because you have to pay it when you're abroad and get reimbursed when you're back. Travel insurance is still the way to go. It's a cheap, if you can afford that trip, you can afford a little bit of travel insurance. And for $250, you might as well get $1 million of coverage if you go overseas. But I always said this to my clients, that if you get travel insurance, it really isn't the insurance you're buying. It's the help you get overseas, especially if you don't speak the language. What happens is if something goes wrong, you get that card, your medical card, you call that number on the back, and you get assistance to go where you're going to go, what hospital, what they're saying, where you're going to go, how you're going to get back home. They will guide you through that step by step on the phone.
Oh, wow. I didn't know
That's what you're buying that for.
Sure.
That's just peace of mind when you're traveling. I mean, I've been over in Europe, and I've tried to get my car fixed that I'd rented over there, and I was in Italy, and no, I take that back. That was in Paris, and they only would talk French to me, and I had to wiggle my way through for that. And if I had even had somebody to call at that point, it would have probably cost me 50% less, number one, but it would have been a lot less hassle. And if it was medical, I would have that card. And I think about that every time I talk to somebody about that. So it's good to know that there's help out there when you're traveling.
But that's for international when you're traveling. But back to Medigap, that's a supplemental insurance you're talking about, and that can help cover things. But again, better use travel insurance if you're going abroad. But you do have to pay a monthly premium for Medigap, right?
Absolutely. And that can range anywhere from $50 to $300+ depending on the plan or your location.
Sure.
I really realize you really have to look at where you live, because every zone in the state of Minnesota is a little bit different.
It is.
When you get down towards Mayo Clinic and you're buying insurance down there, that's more expensive than it is up in the metro, and it's a different one up by the North Shore. So you really have to know where you live and shop accordingly.
Yeah. So how does Advantage? So we talked about Medigap or supplemental insurance. How does Medicare Advantage fit in?
Well, Medicare Advantage, I've really gotten to like a lot. It also fills the gap. It's called Part C, and it's an individual product. These plans often include extras like dental or vision and have a cap of out-of-pocket expenses, which are normally really affordable. I mean, when you look at old-fashioned insurance where your deductibles are $6,000, $8,000, whatever, with Medicare Advantages, this is a max out-of-pocket. And I very seldom see anybody touch that. Unlike, though, original Medicare, you may be limited to plan networks and doctors and hospitals, which might not suit everybody. But in Minnesota, and I want to, when you're talking to certain Medicare Advantage plans, I have plans that offer large networks. And in the state of Minnesota, I have about 96% of the providers in the plans I sell. So don't let that scare you, but you have to do your homework or have somebody do the homework for you.
So there are some trade-offs. I mean, you can stick with original Medicare and maybe add a Medigap for flexibility. Or I think the really popular thing today to do, and one of the better options is Medicare Advantage for potentially lower costs and extra benefits. Is that what I hear you saying?
Yeah, exactly. It's about what fits your health needs.
Yeah, everybody's situation is different. Right?
And your lifestyle. If you travel all year round and you go to different states, you might look at that Medicare supplement because those are portable. You can go from state to state. You can move with it. You can be gone longer than 6 months or 9 months. It's going to be available to you. So you got to have it look at your lifestyle. And Medigaps have flexibility. Advantage plans, they're potentially lower cost with a lot of extra benefits that you can rely on. Yeah. And that out-of-pocket maximum, that's really big. But I do have to let you know, and I'll say it again, open enrollment is October 15th through December 7th. And I'm not just picking on you, Care, but this is the time for you. I don't care if you have Blue Cross, Medica, Health Partners, United Healthcare. I don't care what you have. You need to know how your plan works. You need to know that your drugs are covered. You need to know that you can afford that premium, and you need to know that it's right for you.
Yes, exactly. Well, we're out of time for today's show. Some great advice today. And remember, listeners, Todd has resources. They're on his website, which is yoursafemoneyshow.com. Or pick up the phone. Give him and his team there a call at 855-22-MONEY. That's 855-226-6639.
Hey, thanks for spending time with us. And remember, if I can't prove it, don't do it. Have a great weekend.
And that does it for this episode of Your Safe Money Show with our host, Todd Schober.
Your Safe Money Show.
Your Safe Money Show is brought to you by Schoberg and Holmstrom Financial Services in Mora, Minnesota. The agency is an independently owned and operated and is not affiliated with any other safe money or government agency. Call the office at 855-22-MONEY, 855-226-6639 for your no-obligation appointment or visit yoursafemoneyshow.com.